Hi, I'm Kristen Melton. I'm a licensed marriage and family therapist. I've been practicing for over 10 years, and I also have been working in schools for over 4 years, helping children with social emotional needs. Thank you for joining me today. We will be discussing how you as parents can help your child with ADHD ultimately find their superpower and hopefully avoid some of the negative effects that ADHD might have on kids and adults throughout their lifetime. So what is ADHD? ADHD has 3 different categories. The first category is inattention, and that's what we know as ADD. But now under the DSM-5, it is under ADHD. The second type is hyperactivity and impulsivity. And this is the type where you see the kid having a hard time sitting still, fidgeting, talking, interrupting others. Whereas the one I mentioned before, the inattention, that tends to be where they drift off, they have a hard time focusing, things like that. And the third type is combined presentation, and that's where the child meets both inattention and hyperactivity and impulsivity. Sometimes you will also hear ADHD referred to as VAST, a variable attention stimulus trait. A lot of times people will also talk about ADHD as executive dysfunction in the brain, and that is because that is the part of the brain that is affected. And it makes sense, that's where self-awareness, inhibition, nonverbal memory, self-regulation, self-motivation, planning, problem solving, all happens. And children and adults with ADHD have a very difficult time with many of those. So let's talk about why it's so important to treat ADHD hopefully earlier than later, which isn't always possible because it's not always recognized until later. But if it is able to be assessed and diagnosed earlier on, there are many interventions that can help a child avoid some difficulties in life. An interesting fact is that people with ADHD can have a shortened lifespan, up to 13 years. So that's a lot of time off of a person's life when you think about it. Also, people with ADHD are more likely to have trouble in school, at home, and with the law. And many people with ADHD also deal with mental health issues such as depression and anxiety. So let's talk a little bit about this. When we think about somebody losing 13 years off of their life, that could be due to risky behaviors, impulsivity, especially in the younger and teen years. There's a lot of addiction related to people who have ADHD, which oftentimes they're seeking that dopamine fix pretty quick through substance abuse. So what are some of the steps that we can do to help children with ADHD? The first one that we always want to start with is sleep. So the CDC says that children 6 to age 12 should be getting 9 to 12 hours of sleep. Most kids are not getting anywhere close to this, but it's crucial because if we're not getting enough sleep, our brain can't function properly. We're going to be more irritable. It's hard to focus. So a tired kid can look to have some of these ADHD symptoms, but by getting enough sleep, we can help reduce some of these things. And a teenager, age 13 to 18 years old, should get 8 to 10 hours of sleep. And most teens, once again, are not getting anywhere close to that. So what are some things that we can do to help kids get more sleep? The first thing is limit screen time, at least an hour before bedtime. I know that's rough with the way our world is today, but if we can limit it at least 30 minutes to an hour, that will help them quite a bit. And that includes the TV, phone, tablets, any screens. If we can reduce that, it will help them get a better night's sleep. Having a regular sleep hygiene is also really important. So what's the routine before the kid goes to bed? Do they take a shower, change, brush their teeth, read a book, talk for a little bit, then lay down? you want to try to have the same routine every night so it's predictable and they can wind down. Now, you will find some kids with ADHD tend to need a burst of physical energy activity before bed. So sometimes a fun game that younger kids will play is the floor is lava, maybe 30 minutes before bedtime, so they can get out some of that energy, wind them down a little bit. Also, sleeping in a dark room is very important. Any light will affect the person's sleep and REM cycle, so sleeping in a dark room also helps very much. Number 2, the other thing that we can do that's a natural intervention is exercise. And as we know, exercise can help any mental health issue. It releases those feel-good chemicals in our brain. So when you're able to exercise, make that a regular routine in a child with ADHD's life, it really can help them physically as well as mentally. And exercise, especially balance, has been shown to help children and also adults, but especially children, learn to focus. So any sports activities that involve balance, or even doing balance exercises like on a wobble board, can help a child learn how to focus a little better. And that also affects the cerebellum, where the focus develops. So just another natural thing that you can do to help a child with ADHD, regular exercise and play. The next step. What's the next step after making sure the child's getting enough sleep and exercising on a regular basis, physical activity? Well, most of the time it's either medication or therapy or possibly both. And as a therapist, I know the struggles that many parents and kids face when they hear medications. Nobody wants to medicate their kids, if at all possible. And the fact is when it comes to ADHD, medication has been shown through research to be pretty effective and safe at this point. There are 2 types of medications that can help. The first one are stimulants, and then there also are non-stimulants. So this is a conversation that you should be having with your doctor, as well as doing your own research to see what you can find out there and make sure that you feel comfortable with it. As far as therapy goes, therapy, especially CBT, cognitive behavioral therapy, can also be pretty effective with kids with ADHD, and some social skills groups as well. So most of the time, medication and therapy together provide the best results. But it is important that as a family, you guys decide what's best for you and your child. So after reviewing some research, there was a study done in 2018 where it showed that 70 to 80% of kids with ADHD who had medication showed improvement. That's significant. So medication does in fact help kids with ADHD. And this study looked at 133 different studies, and this is what the results were. So something to consider if your child is struggling. And remember, when it comes to ADHD, you want to make sure that the child is having issues in 2 or more settings. So a kid with ADHD is not just going to have problems at school. They're going to show problems with school, home, social settings, so a variety of different settings, and it has to negatively impact their life. So they're struggling academically, socially, emotionally. So as parents, what are some things that you can do at home? Home's a big part of the child's life, and one of the best things that you can do as a parent is helping your child develop and follow and learn schedules and routines. So what this might look like is every morning they wake up, what should they be doing? Do they run in the kitchen and have breakfast, or are they supposed to go brush their teeth, brush their hair, get dressed, and then come to the table and have breakfast? When it comes to scheduling time for your child, sometimes helping them understand we're going to have breakfast for 30 minutes and then it's going to be time to get ready for school. So breaking things down into time blocks can help. Now, if they're too young to read a clock, you may use a kitchen timer or set a timer on the phone, or ask Alexa or Siri to set a timer that a child can hear when it beeps. They know then to transition. As parents, it also is very helpful to set the expectations and consequences with your child ahead of time. The child should be able to predict, if I do this, this is what's going to happen. When they don't know what's going to happen, they're going to run until they hit the wall or until something negative happens. So when you talk to them, sit down and say, we're going to do your homework, and once the homework's done, then you have free time to play. If you don't do your homework, then you're not going to be able to have fun time or free time. Set that clear expectation so there's no surprises, and whatever you discuss needs to be stuck to so they're able, once again, to predict that. Some tips that, as parents, that you can do with your children that will help make your home life a little bit easier is when you're asking them to do something, make sure that the child is looking at you. Make sure you have eye contact with them. One of the things I do in the therapy office is I will say, can I see your eyes? So that way I know that they're looking at me. When you give a directive to a child and you don't have eye contact with them, it's really unclear if they heard that, if it even got processed, or it just floated right through their head. So eye contact. I also suggest that you ask the child to repeat back what you asked them to do. That ensures that it did actually get processed in the brain and that they heard it, it got registered, and they're repeating it back and they know what to do. Visual cues are very important. Trust me, kids with ADHD are going to be told no, don't, stop a million times. So it's very easy for them to block out voices, okay? So when you need to get a child's attention, you might wave rather than just call out their name. You might point. You might use some cues like that, tap them on the shoulder. When you mix up some of these things, such as visual cues as well as verbal cues, it helps them not drown out your voice. It helps them not get so irritated every time you say their name. As I mentioned earlier, I'm a big fan of timers. You know, it kind of gives that external cue, once again, rather than the parent's voice always being that nagging reminder that they hear over and over and over. Making things fun is a great way to encourage kids with ADHD to get things done that they need to do. A great example is maybe having a basketball hoop and below is the laundry hamper, so they can throw their dirty clothes in the hoop and it goes into the laundry hamper. It's a game, it's fun. Another one might be setting a timer and seeing who can clean their room or the bathroom the quickest. Kind of a game, a challenge. So be creative with it, and involve them, talk to them. Maybe they can come up with a really cool game that will help motivate them to want to do some of these tasks a little bit more. And I can't stress this enough. Remember, all behavior is a form of communication. So if your child is having maybe a negative behavior, acting out, having a tantrum, it is a form of communication. So I'm asking you to put the behavior aside and try to look at the emotion underneath that behavior. What are they feeling? What are they trying to express that they're having a difficult time with? This will save everybody a ton of headache and tears if you can do this. At school, as parents of a child with ADHD, please be the advocate for your child. They're going to need you throughout their time in school. It's not an easy place. It's a very strict and structured place typically. And kids with ADHD have a difficult time remaining in their seat, following directions for 6 hours a day. They need breaks, and school isn't set up for an ADHD kid's brain to have several different breaks throughout the day typically. So there are ways to get accommodations in schools. And the first one is through a 504 plan. And in that, what can happen is, as a team, typically the parents, the teachers, an administrator will sit down, maybe a school counselor as well, and talk about what supports could be implemented in the classroom and at the school to help the child be able to learn better, reduce negative behaviors and disruptions that happen in the classroom. Some of those accommodations might be flexible seating. So there's balls that kids can sit on, wobble chairs, rubber bands on the bottom of a chair that kids can mess with. Some teachers will allow children to have fidget toys, something that they can play with in their hand to help them focus. Some younger kids struggle with that because it then becomes a toy and they throw it across the room and now it's a bigger disruption. So you have to make sure the accommodation is appropriate for the child you're writing the plan for. Also, breaks can be important for kids. It's hard for them to sit and focus for long periods of time. So some kids who have a 504 plan will be given a pass where they can leave the room and take a quick break. Maybe they go to the nurse's office, maybe they visit the school counselor, maybe it's just a quick bathroom break and to get a drink and come back down. Also in a 504 plan, after a kid has finished an assignment, you can implement rewards, small rewards so it doesn't seem unfair for other kids in the classroom, but just recognizing that the child was able to start something and finish it, which many kids with ADHD struggle with on a regular basis. There's many other accommodations that can be done, and most schools are very much aware of this. If not, you can Google it, you can research it, and get them implemented on the plan. If a child is needing further assistance, maybe they also have a learning disability, that is where an IEP plan comes into place, and that's a more intense type of plan, but also involves some similar supports that were mentioned before in the 504 plan. In school, kids with ADHD typically will have some form of behavior problem at some point. Once again, whether they can't sit still, keep their hands to themselves, touching this person, interrupting the teacher on a regular basis. So if those things are happening, once again, accommodations can be put in place, maybe just meeting with the school counselor to talk about some strategies to reduce that can be a good idea. Many kids will eventually develop a mental health disorder, such as anxiety, depression. And if you think about it, it makes sense when a kid is always being told, why weren't you paying attention? Why don't you know? I was talking about it. No, don't do that. What's wrong with you? You're bad. You're not making good choices. So on and so forth. Constantly being corrected in a sense, or constantly feeling lost because they weren't able to focus and their mind wandered off. It can later cause problems, especially year after year after year, if it's not being addressed and skills given to help them work through this and people being aware of this to support them rather than to further break them down. Communication is essential. As parents, you want to communicate to the teacher. If you can share with the teacher some of the struggles that your child deals with and maybe also provide some things that motivate your child, the teacher is going to better be able to assist your child to succeed, and there will be less of those negative comments. Regular check-ins are very helpful. That helps everybody be accountable and stay on track rather than waiting several months to go by or half the school year to go by and the teacher stating that the kid's out of control, they don't know what to do, they're failing. Check-ins typically happen either on a day-to-day basis, just very brief, or kind of a weekly summary how their week was. And once again, please remember and make sure that the teacher working with your child understands that behavior is a form of communication. So if things are happening in the classroom, let's look at what's underneath that behavior, what emotion are they feeling, and address that. Kids with ADHD tend to have difficulty in social settings and with peers. Yes, they can be very talkative, they can be the life of the party at times. However, they can also have a difficult time in those relationships because they're talking over their friends, they're not paying attention to their friends, they're lost their train of thought and they don't know what their friend just said. They have a hard time with personal space. They might touch and enter into people's personal space, touch too hard, hit too hard, grab too hard. And that can cause friends to feel uncomfortable and uneasy around them. Also, the tone and volume that they speak in sometimes can be too loud and hurt other people's ears. They're not aware of their tone at times. They also have a difficult time regulating their emotions. So they might become irritable or angry or frustrated with their friends and peers a lot quicker than other children. So they have those big blow-ups with their friends, and maybe that big blow-up really was over something small that shouldn't have been that big. So helping these kids understand how to regulate their emotions and not have those big explosions on their friends will help them keep those friendships for a lot longer. Finding your child's interest is key. It is so important to help children with ADHD find and connect with something that interests them. They're very creative. Their brain is going at 1,000,000 miles an hour. So when you're able to help them connect to something that they're passionate about, it's something that will be a continual motivator throughout their life. They need something fun. If they don't have something that they're interested in, they will feel lost, they will feel disconnected. So helping them connect to that and supporting that, as long as it's healthy, of course, is very beneficial to their well-being. The one thing is sometimes kids with ADHD, as they're trying to figure out what their real passion is or their interest is, they'll try several different things. And a lot of times they might not finish it. Remember, that's part about the way the brain functions. So they might do 90% of it, and the last 10%, they're like, no, I'm good. And that can be very frustrating to parents. Like, no, you have to, whatever you start, you have to finish. So if that's your belief and the way you function as a family, that's fine. But talk to the child first about that and set that expectation that if you're going to start this and try this, you have to at least finish it. And if you see them struggling with it, take the time to talk to them about it and maybe develop some skills, some encouragement to help push them through. Time issues. This is really, really, really important. Children with ADHD and adults, it lasts the whole lifetime, have issues with time. They're in the present. If you ask a child to plan something 2 weeks from now, they're not going to be able to do it. That seems like 6 months away. So when teachers give assignments, like a big assignment, say it's a 2-week project or a month-long project, the child oftentimes won't even recognize that something is due until a few days before or the night before. They're very much in the moment. So that is an important skill to talk about and to help them work on. And this can be done by implementing organizers and planners, whether it be on a tablet or paper, having regular check-ins and conversations, breaking down assignments or projects into steps. So step 1 is due tomorrow, step 2 is due in 2 days, and so on and so forth. The ADHD brain is like being a race car with bicycle brakes. So if we break that down, that means your brain is going super fast all of the time. And when it's time to stop, guess what? You don't have those car brakes, the race car brakes, you have bicycle brakes. So are bicycle brakes really gonna slow down a race car? No way. So kids with ADHD need more time to slow down, to stop, to think. That's why you see some of that impulsivity. So just remember that when you're working with them, they're not always gonna be able to stop right away. There are some really cool things that you can do, though, to work with your kids on that. A fun one is red light, green light, stop and go. Any games that involve that type of movement, musical chairs, where they have to listen and then stop quickly or sit down quickly, can help with that as well. As parents, help your child find their superpower. ADHD doesn't have to be all negative. Yes, there's some things that they'll have to struggle with and learn and get through a little bit differently than maybe some other kids. But there are great things about it too. Kids with ADHD are typically very creative. They can think outside of the box. They are oftentimes entrepreneurs. They're oftentimes very smart because they can work through situations. So remember, with the negative come a lot of positives. And the more you can help your kids see the positives, the better mental health they're going to have, and the better they'll be able to get through life. And one important thing is, as parents, you guys can really emphasize the positive reinforcement. Remember, they're going to have plenty of negative reinforcement in their life. So when you can tell them, you're not a bad child, that just wasn't the best choice. Let's slow down, let's break it down, let's think about it and try again. You can really help them work through those difficult times.